It is time to take a look at the heart. How hard is your heart working? The heart can never take a break. If your resting heart rate is an optimal 60 beats per minute, BPM, it beats 86,400 times a day, or once a second. Actually, with a beat of 1 per second or less, your heart gets to rest a little between beats. If your resting heart rate is 80 beats per minute, the heart is beating 115,000 times a day, or 28,600 times more than it should, which means your heart is basically jogging all of the time. A heart with a pulse rate of 55 BPM will last longer than one with a pulse rate of 75 BPM. In the animal world, the animals with a faster heart rate have a shorter lifespan than those with a slower heart rate. Consider the hummingbird versus the elephant. A hummingbird with a heart rate of 250 BPM has a lifespan of 3 to 5 years. An elephant, on the other hand, has a heart rate of 30 BPM and a lifespan of approximately 30 years. Basically, the faster your heart beats, the faster you die. A decrease in heart rate from 70 to 60 BPM would further increase human life expectancy from 80 to 93.3 years. Do you know what your resting heart rate is? Another consideration: how hard is your heart working? The higher the blood pressure, the harder the heart is working. Multiplying your heart rate and systolic pressure, the top blood pressure number, gives a measure of work called the cardiac workload. A 60 BPM pulse rate times a 120 systolic blood pressure equals 7,200 cardiac load. This would be an ideal cardiac load. A heart rate of 80 BPM and a systolic pressure reading of 140 give a cardiac load of 11,200. The higher the cardiac load, the harder the heart is working, the more energy it needs, and the heart will not last as long. The NTB-type natriuretic peptide, BNP, blood test, called the BNP test, is very important in determining how much stress the heart is under. This test can predict death, even when all other body signs look stable. Polypeptide is secreted by the ventricles of the heart in response to excessive stretching of the heart muscle cells. BNP is elevated in left ventricular dysfunction and correlates with both the severity of symptoms and the prognosis in congestive heart failure. BNP is a useful marker of cardiovascular risk, even in people with no clinical evidence of cardiovascular disease. Oftentimes, the first sign of cardiac disease is sudden death. The levels of BNP predict the risk of heart failure, first cardiovascular events, atrial fibrillation, stroke, or transient ischemic attack. There are several things that make the heart pump faster and harder, including being overweight and smoking. However, anemia, liver and kidney diseases will affect the heart, as will vitamin and mineral deficiencies. Heavy metals, chemicals, and drugs can also increase pulse and blood pressure. Fortunately, there are many natural foods and nutrients that have been shown to be beneficial. A thorough science-based nutrition report may help identify some easy things for you to do that could take stress and pressure off of your heart. Don't delay. Get a comprehensive evaluation, including blood tests with BNP, and start to give your heart a break. Start by completing our patient symptom survey, which aids in determining what comprehensive tests to order, informs us of any medications you are taking, and indicates the symptoms you are experiencing. Once your test results are in, we compile all of the data in a comprehensive, color-coded report that is easy to read and understand. Using your unique test data, the science-based nutrition report will reveal your underlying health deficiencies and indicate the nutrients and diet that will likely help you progress toward a healthier you. Contact us today to learn more about the science-based nutrition program.